Our task was to look across the care sector, so everything from early childhood education and care through to aged care and everything that comes in between. And so where we ended up focusing in the 3 reform areas are where there are silos, so the intersections between parts of the care system. And so through consultation with people working in the sector, with government organisations and community members, we've also identified where we think the focus is best placed, at least as a starting point. So we were tasked with coming up with practical and implementable reforms. And so the areas that we've identified are across 3 areas. The first is around ensuring there's greater regulatory alignment so that there's a greater coherence across the care sector. So in the first instance, we say aged care, veterans care and disability, because there's a lot of crossover and duplication there. And we know that that will make things more efficient for workers, for providers, and more importantly, increase quality and access for people who use care or need care. The second area of reform is around what we call collaborative commissioning, which you mentioned. And that is really a place-based approach to identifying the needs of the community, to working together across different parts of the health system in the first instance, to better plan and deliver services that meet the needs of that community. Also, importantly, working together with Aboriginal and Torres Strait Islander communities and organisations who are both delivering services but also receiving services in those regions. And then the third area is a really important one around a framework for investing in prevention. We know that Australia, compared to other OECD nations, doesn't invest enough in prevention, and we also don't have great coordination between the activities across different portfolios, if you like. So where an investment in something like housing might pay dividends in relation to health outcomes for people, we're not very good in our budgeting systems at realising the gains that are delivered by one portfolio area into another. And so we think there should be a system that actually recognises those benefits of investing earlier, investing in evidence-based initiatives that deliver better outcomes, but being able to realise them across different parts of both the economy, but more importantly, across different parts of people's lives.